of our study, effect of dietary phosphorus deprivation ante partum on the calcium homeostasis of periparturient dairy cows. So we know periparturient hypocalcemia in its clinical and subclinical form is one of the most important metabolic disorders and leads to high economic losses. Excessive dietary phosphorus contents in legislation negatively affect periparturient calcium homeostasis. But feeding at the lower end of phosphorus recommendation leads to a less pronounced decrease in plasma calcium concentration and parturition. So again, how does the dairy cow's organism respond to hypocalcemia? Hypocalcemia at the onset of lactation, for example, is sensed by calcium sensing receptor in parathyroid and is followed by a release of parathyroid hormone, PTH, afterwards. On the one hand, increased parathyroid hormone has a positive effect of calcium bone resorption, and on the other hand, it leads to increased conversion of 25-OHD3 into 1,25-dihydroxyvitamin D3, which is the active metabolite of vitamin D. All this is done in the kidney by 1-alpha-hydroxylase and leads again to an enhanced bone resorption and a higher increased absorption out of the gastrointestinal tract. There are many more factors influencing calcium homeostasis. For example, we talked about that, the phosphate concentrations, but here are not really all mechanisms known, so we have to further do something about that. So our objective was to determine the influence of marked phosphorus deprivation during transition period on the calcium homeostasis of the periparturient dairy cows. In this case, we had 18 multiparous dairy cows, which were randomly allocated into two groups. And all of them got a total mixed ration, which was in the acclimation period, which was 2 weeks, was in the same components, with adequate phosphorus content. And 4 weeks before parturition, we start with phosphorus depletion in the low phosphorus group, which is green here. After calving, again, cows got another ration for fresh cows, which was phosphorus depleted too. We took at several points of time blood samples at the end of acclimation period for baseline values, and on day -10, -2, +1, +3, and +10 relative to calving, and analyzed them for phosphate, calcium, PTH 1,25-dihydroxyvitamin D3, and cross-labs as a bone resorption marker. So again, to show that the diet worked, we have here the plasma phosphate concentrations, which were during the phosphate depletion periods significantly lower than in the control group. And now we have plasma calcium concentrations, which were increased in both groups before parturition, but numerically higher in low phosphorus group, and of course decreased at parturition with the onset of lactation, and increased afterwards again. But we had significantly lower plasma calcium concentrations in control group. And we had 3 of these 18 cows had clinical signs of hypocalcemia, but we have had none of clinical signs of hypocalcemia in low phosphorus group. All cows were treated after blood sampling and were not included in the next parameters to not disturb the homeostasis. PTH was not affected before parturition, but was increased. It is not, you cannot see it very good, but it was increased in both groups, but up to 6-fold higher in control group. So we had significantly higher PTH levels in the control group. 125 dihydroxyvitamin D3 increased in both groups after parturition, but despite those differences in PTH, we had no significant differences in 125 dihydroxyvitamin D3. And now we have the cross-labs as a bone resorption marker. Here we can see that in low phosphorus group, they were increased before parturition and afterwards in both groups, and we had significantly higher concentrations in low phosphorus group on day +3. So how does that fit in our calcium homeostasis? To get a clue on it, we have to introduce another factor which is known out of the phosphorus homeostasis. It's the FGF23. It's a phosphatonene which is released out of the bone, and it has a higher. It increases with with increased phosphate plasma concentration and leads to a suppression of the 1-alpha hydroxylase, so that we have a lower conversion rate from 25 OHD3 to 125 dihydroxyvitamin D3. So, but first of all, we had a direct effect on the bone resorption. The low phosphate concentration lead to higher calcium bone resorption, and we had, because we had in low phosphorus group a lower decrease at parturition, and so we had a lower increase in PTH. But again, we had the same level in 125 dihydroxyvitamin D3. So our suggestion is that low phosphate concentrations lead to a decrease in FGF23, and so we have a higher activity in the 1-alpha hydroxylase despite this smaller increase in PTH. So further, we can conclude then that dietary phosphorus depletion in transition period is positively affects the calcium homeostasis around parturition. We had an enhanced bone resorption, and we suggest an increased activity of the 1-alpha hydroxylase. But of course, further investigations are needed to explain the whole mechanisms and to determine if there are possible negative effects on health and productivity of dairy cows. So thank you for your attention.